The last category of drugs that might be effective against MS are some neurologic drugs, also listed on page 80. There's just a couple of them that are listed here. These drugs try to protect the nerves and the myelin sheath from destruction, therefore reducing symptoms and kind of slowing the progression of that MS. So we've got dimethyl fumarate or Tecfidera, and that reduces inflammation in the central nervous system. And if there is less inflammation, there are less inflammatory responses that produce white blood cells and cytokines and other chemicals. And so that helps protect the myelin from getting further damaged. The Ampyra, or dalfempridine, it's a mouthful, blocks potassium channels in those unmyelinated nerves, and they are able to function. This, because of how it works, it decreases the seizure threshold. That means it can make somebody more likely to have seizures. If they don't have seizures, it could increase their risk. If they already do have seizures, it could make their threshold even lower. So the reason this particular drug is in red is because a patient who has seizures should not take dalfempridine or Ampyra. They need to take something else. Side and adverse effects, once again, it affects the immune system, so they can be at a higher risk for infection. They also can get headaches, GI problems. They can be dizzy, their muscles can feel weak, and they can get confused. There also can be flushing, itching, and rashes. So folks taking this have to be warned about all that. So make sure that you read Chapter 9. Make sure that you know the key terms at the beginning of the chapter, as well as being able to read all the key points on pages 180 and 181. These are very important. And look through the PowerPoints. Remember, your PowerPoint's kind of your study guide, as well as reading the book. You also want to read the sections indicated in the ATI book too, to help get ready for this test, as well as for your ATI test when it comes later.